of you who don't know me, I am Diana Richardson, and I have the joy and honor of serving as your CEO and president. And we're here today to celebrate Pride Month, celebrate the raising of the flag, but I want to actually just reflect for a moment. I have always been proud of Massachusetts healthcare and our approach to pride in general, but certainly LGBTQ plus rights and inclusion, but inclusion in a way that celebrates not only our employees but also our patients and also the relevance to healthcare and all of those things. I've always been proud of Massachusetts healthcare. I've always been proud, in my time here, of Merrimack Health's commitment to that. But the past few days I had sort of an interesting reflection. I had a friend who was visiting me, a friend from Florida, who has a grandchild who is transgender. And as we walked around the city of Boston, and I mentioned my friend lives in Florida, as does her grandchild. As we walked around Boston, she continued to comment and even take pictures of all of the pride flags that were going up to celebrate this month. And some of those pride flags, I live in the South End, some of those pride flags are actually up year round, which I mentioned to her, and she was like, that's amazing, that's wonderful. She kept taking pictures and sending them to her grandchild, which, I thought, oh, that's kind of sweet, it's, grandma, whatever. And then she started talking that, I really wish that JT, it's her grandchild, I really wish JT could live here. I wish JT could live in a place that not only would she be included, but she would be welcomed and celebrated and safe and part of the community. And it's a joyful part of who she is to celebrate, as opposed to something to be worried about. How is someone going to treat her? How is someone going to treat her when she walks into a store, to a restaurant, or to a healthcare provider? So, standing here today, I just want to take a moment to reflect on the flags that, we don't have much wind today, but the flag that we have to celebrate, the flags that we're carrying, the flags that you see around the city, around the region, and the state, that the flags are important not just as a statement of this is who we are, but they're a statement to everyone really around the country about how healthcare should be, how communities should be, and how life should be. So thank you for joining me this morning. Thank you for celebrating. Thank you for being proud with me to stand as an ally for all of our patients, all of our community, all of our employees, particularly during Pride Month for our LGBTQ plus population. So thank you for joining me this morning. And with that, I'd love to introduce Bobby Rodriguez. Bobby is our not so new, I think he's been here 8 weeks now, Chief Human Resources Officer. So Bobby.
Good morning and buenos dias. You can hear me, yes? Okay, first, happy Pride. You don't know what really means happy Pride until you live in a state that is outside Massachusetts. Moving from Ohio right now, where you don't have any rights, where every single clinics between Kentucky, Ohio, Indiana, for transgender health for all the kids, adults, start being closing and prohibiting many places and many rights. When you see that bathrooms still a struggle in a place where a person cannot identify and go to the bathroom that they belong. But before start some of the comments, I want to say, Diana, thank you for the introduction. If you don't know myself, I am new exactly 64 days at Merrimack Health. I know she's laughing. 64 days today, and it's been a pleasure. I'm your Chief Human Resource Officer and a person with a big heart for people. I'm going to start first. Pride Month is such a meaningful opportunity for us, and not only to celebrate, is also to actively support our LGBTQ plus community, employees, patients, family, and the whole community, not only LGBT, but learning about other communities behind. It's also a moment to reaffirm who we are as an organization. One that everyone needs to feel respected, valued, seen, and included. This is also about health equity, and a topic that is in my heart. We know that LGBTQ plus individuals continue to face real disparities in access to care. They're afraid to talk about it. It also affects health outcome, all over experience without the whole healthcare system across the nation. Our commitment to inclusion directly impacts our ability to deliver equitable, high-quality care for everyone that we serve. Yesterday, we raised the rainbow flag across the campuses. And I have to say, it's always a powerful moment. That flag is more than just a symbol. It represents the diversity and strength of the LGBT community, including so many of our colleagues, friends, and patients. And with this inclusion of the black and brown stripe, it also represents the LGBTQ plus people of colors and reinforce the importance of making sure every voice is seen and represented. I want to thank each of you, the role that you play in creating a welcoming and inclusive environment at Merrimack. That spirit is not just reflected at one flag, it shows up every day in how we treat one another in our actions, our words, and the care we provide. At the end of the day, it's our differences and similarities that make us stronger. It makes us better as a team. And it's essential to achieving true health equity and delivering the kind of compassion, high quality care that our community deserves. Thank you y muchas gracias.